Tuberculosis remains the world's leading infectious killer, according to the latest World Health Organization Global Tuberculosis Report released in Geneva. The disease claimed an estimated 1.23 million lives in 2024. Despite this staggering figure, WHO says global efforts are finally showing signs of progress after years of pandemic-related setbacks. WHO Director General Tedros Adhanom Ghebreyesus presented the findings during an online press briefing, describing them as a cautiously positive development. Today, WHO is publishing this year's Global Tuberculosis Report, which shows a decline in new TB cases and deaths for the first time since before the COVID-19 pandemic, he said. Meanwhile, the number of people being tested and treated is increasing. The report marks the first time since 2019 that global TB indicators have moved in the right direction. WHO data show that disruptions caused by the COVID-19 pandemic had reversed years of progress, delaying diagnoses and reducing access to care in many low and middle-income countries. The 2024 figures suggest that renewed efforts to detect, treat and prevent tuberculosis are beginning to pay off, but Tedros warned that the situation remains fragile. Despite all this good news, progress is not victory, he cautioned. TB still killed more than 1.2 million people in 2024, which for a disease that's preventable and curable is simply unconscionable. The WHO chief also warned that reductions in international aid could undermine the gains seen in the latest data. He said funding cuts to international aid in many low and middle-income countries threaten to reverse the hard-won gains we see in today's report. Vaccine development. A major area of optimism is vaccine research. For the first time in decades, WHO says there is tangible progress toward new vaccines targeting adolescents and adults groups most affected by TB transmission. For the first time in over a century, new effective TB vaccines for adolescents and adults are within reach, Tedros said. At least 18 vaccine candidates are currently in clinical development, including 6 in phase 3 trials. If successful, these vaccines could transform global TB control by reducing transmission and protecting high-risk populations. The organisation stressed that investment in vaccine research must continue, warning that delays in funding could again stall scientific progress. Global burden. Tuberculosis is caused by the bacterium Mycobacterium tuberculosis and primarily affects the lungs. The disease spreads through airborne particles when people with active TB cough, sneeze or speak. While curable with antibiotics, treatment requires months of therapy, a challenge in countries with limited healthcare infrastructure. WHO estimates that nearly 10 million people contracted TB in 2024, with most new infections occurring in Asia and Africa, India, Indonesia and the Philippines. Remain among the countries with the highest burdens, though improvements in detection and treatment coverage have contributed to the recent global decline in deaths. The role of tobacco. In his remarks, Tedros highlighted a key but often overlooked driver of the epidemic, tobacco use. One of the top 5 drivers of the TB epidemic is tobacco use. He said people who smoke are twice as likely to develop TB disease, so to fight TB, we must fight tobacco. The WHO chief condemned the influence of tobacco companies, accusing them of undermining public health initiatives designed to reduce smoking. He linked the issue directly to the WHO Framework Convention on Tobacco Control, known as the FCTC, which has been instrumental in curbing tobacco consumption worldwide. Since the FCTC took effect, tobacco use has declined by 1/3 globally, despite the efforts of the tobacco industry to undermine it. Tedros stated next week the Conference of the Parties of the FCTC will hold its biennial meeting, and we are aware of attempts by the tobacco industry to infiltrate and undermine its work. New nicotine products and industry tactics. The Director General also warned about the rapid growth of new nicotine products, particularly e-cigarettes and related devices. The success of the FCTC has meant tobacco companies have had to develop new products to attract new customers, he said. The use of nicotine products such as e-cigarettes and nicotine patches has expanded rapidly due to aggressive marketing with bright packaging, sweet flavors, social media influencers, and false claims of harm reduction. Tedros emphasized that these companies are not motivated by public health, but by commercial interests. Let's be clear, the companies that make these products are not motivated by harm reduction or health. They're motivated by one thing and one thing only: generating profit for their shareholders. Challenges ahead. Despite incremental progress, the WHO report warns that achieving the global goal of ending tuberculosis by 2030 remains distant. Many countries continue to face shortages of diagnostic tools, essential medicines, and laboratory infrastructure. The organization estimates a multi-billion-dollar funding gap in global TB response efforts, which could widen as international donors shift resources to other health priorities. Officials also raised concern over the rise of drug-resistant tuberculosis, a strain that does not respond to conventional treatment. The report notes that multi-drug-resistant TB remains one of the world's most serious antimicrobial resistance threats, with treatment success rates still below 60% in several regions. The organization called on governments to sustain investments in testing, research, and health systems to prevent the resurgence of TB, particularly among vulnerable populations such as migrants, refugees, and people living with HIV, a global health priority. The 2024 Global TB Report reinforces the message that tuberculosis, though ancient, remains a major global health emergency. WHO says the disease continues to kill more people each year than HIV and malaria combined. The agency credits renewed political commitment, technological advances in rapid testing, and expanded access to preventive treatment for the recent decline in cases. However, it insists that success depends on sustained collaboration between governments, donors, and civil society organizations. In Geneva, Tedros urged all countries to accelerate their efforts. He reiterated that the fight against TB cannot be separated from the broader fight against poverty, inequality, and tobacco addiction. To fight TB, we must strengthen primary health care, invest in communities, and eliminate the social and commercial determinants that fuel this epidemic, he said. The road to 2030. WHO's End TB strategy aims to reduce global TB deaths by 90% and cut new cases by 80% by the end of this decade. To meet those targets, countries must expand testing coverage, improve access to shorter and safer treatment regimens, and ensure sufficient funding for research and development. The organization also called for closer integration of TB control efforts with broader pandemic preparedness strategies. The COVID-19 crisis exposed the fragility of health systems and demonstrated how quickly infectious diseases can regain ground when services are disrupted. In many countries, the pandemic diverted resources away from TB programs, resulting in millions of misdiagnoses. Restoring and strengthening those systems is now central to WHO's global health agenda. Summary. The WHO's latest report paints a picture of cautious optimism, fewer cases, declining deaths, and renewed vaccine hope after years of stagnation. Yet it also underscores how fragile the gains remain, threatened by funding cuts, tobacco use, and industry interference. The Director General's message was clear. Tuberculosis may be curable, but defeating it requires unwavering global commitment. Tuberculosis continues to kill over 1 million people each year, but with new vaccines approaching, stronger health systems, and sustained international cooperation, the world stands at a pivotal moment in the century-long fight to end the epidemic.